Are you suffering with a shoulder that just doesn't move and you're wondering if you might have a frozen shoulder or even what a frozen shoulder is? And maybe you've done some research on frozen shoulder and you're just kind of freaked out and you're wondering what is going on and what you can do about it? Well, then today's video is for you. We are going to be discussing what the signs and symptoms of a frozen shoulder are, as well as what that even means, what frozen shoulder means, but also some tips on what you can do right now to start working on your frozen shoulder. So, what is a frozen shoulder? Well, technically the definition is when your shoulder doesn't move correctly. I know, it's super technical, but basically that's it. If you go see a doctor and you try to lift your arm up and you can't lift it up above horizontal, they'll probably diagnose you with a frozen shoulder. And that can be if it's to the front, that can be if it's to the side, and definitely when you're reaching behind your back. A lot of people struggle to reach behind their back when they have a frozen shoulder because the shoulder's not moving correctly, and reaching behind your back is actually kind of a complicated action. But what is going on? Well, that would depend on what research you read and when you actually read it. I've been a PT for a long time now, and our understanding of what is actually happening when a frozen shoulder occurs has changed. I can't even count how many times. So it's really difficult to say what's actually going on, because if they do surgery on it, then they'll go in and they will find some changes in the tissue there. They'll find changes in the joint capsule, they'll find changes in the joint potentially, and they'll definitely find changes in the muscle. But the question is, chicken and an egg, did all of those changes in those tissues cause the frozen shoulder? Or did those tissues change because of the frozen shoulder? And of course, they're not going to do surgery right away, so it's a delayed process. And the truth is, we don't know the answer to that question. But there has been some new research that has come out recently where these researchers have been studying how the brain is connected specifically to the frozen shoulder. And this is going to be the first idea that I am going to give you because I was so intrigued to hear about this particular piece of research. What they did is they had people who had a frozen shoulder take a magazine and circle that sided shoulder. So let's say you have a right-sided frozen shoulder. Then you would take a magazine, and every time you saw a right shoulder, you would circle it. And you go all the way through the magazine and circle all the right shoulders. At the end of the study, that is literally all they had everybody do. At the end of the study, they tested their range of motion, so how much they could lift their arm, and it had increased by 5 degrees. Now, 5 degrees, I understand, is not a huge change, and if you have frozen shoulder, you're like, well, I mean, that's not really gonna, break the bank for me, but all they did was circle right shoulders. So, if you have frozen shoulder, go grab a magazine, circle the sided shoulder of your frozen shoulder, and you'll get 5 degrees more motion, right? That's pretty easy to do. More importantly, potentially, is what that taught us is that nothing changed in the joint, in the shoulder, in the tissues of the shoulder while they were circling those shoulders in the magazine, right? So what changed? Their brain changed. So their brain started paying attention to the shoulder that they were circling in the magazine, which is the side of their frozen shoulder, and it brought awareness. It brought the brain's awareness to that shoulder, which helped to increase their active range of motion by 5 degrees. What that's telling us then is how we've thought about frozen shoulders previously is probably all wrong. These researchers went on and did another study, and what they did is they put people in front of a mirror with the good arm moving up and down and the frozen arm behind the mirror. So the good arm is going up and down in the mirror. Of course, they're looking in the mirror, so it looks like the good arm is going up and down as well, right? What they found is they didn't tell anybody that they had to move the frozen arm, but as the good arm was moving up and down, and as they were seeing it in the mirror move up and down, the other arm started moving too. And these people had a measurable increase in active range of motion after doing that exercise as well. So there's tip number 2. So we have this mirror over here that we can pull out. You need to find a mirror where you can move both arms, but only see the good arm, the one that moves through that full range of motion. But get in front of it, look into it, watch your good arm move up and down, and then as the other arm feels safe and comfortable, let it move through the full range of motion that it's capable of. Now you won't necessarily get all the way to the top, but hey, what would you do for another 10 degrees just by looking in the mirror? That's not that hard to do, right? Give it a shot. Drop a comment below. Let me know how it goes. So what we're learning is that the brain connection to frozen shoulder is way more significant than we knew. So if we can go in and trick the brain, then we can definitely give it some different signals. That will help to decrease the effects of the frozen shoulder, because what we're learning is that it may not be actually a structural issue, but it may be the attachment to the brain and how the brain is acknowledging that shoulder. So for my patients with frozen shoulder, what we do is we work on the muscles that are surrounding the shoulder, specifically the rotator cuff muscles. So the rotator cuff muscles help to hold the shoulder in the cup so that it stays firmly seated there. But they can get really tight and then it kind of causes a compression. Well, obviously that compression is going to cause pain as you're trying to lift your shoulder. So what we do is we work on decreasing the tension in the rotator cuff muscles, which will then allow the shoulder to move more easily. I also ask my patients to not try to lift their arm while they're working against gravity. So if they're sitting or they're standing, what I want you to do instead is I want you to lay on your back and try to lift your arm that way. Or if it's more limited going out to the side, then you can lay on your side and try to lift it out that way. Whichever one is your primary limitation area. Going to the front generally is easier. Going to the side is a little bit harder. So usually we'll start, if you're limited in both, usually we'll start with going to the front. But when you are lifting your arms to the front and you're laying on your stomach, it keeps you from doing that shoulder shrug. Because you may have noticed that in order to try to get that shoulder to go up further, you've started shrugging it up by your ear. Well, this is going to cause problems with the muscles that cross from the neck to the shoulder. So we want to make sure to keep that shoulder down in its normal position as if you were just lifting it normally without this frozen shoulder problem. It's difficult, it's tricky because it's a natural reaction that our body has to try to lift that shoulder up in order to get more motion. And it's something that you've probably been doing subconsciously since this started becoming a problem. So I need you to really consider that as you're trying to lift that arm. I prefer not to do it in sitting or standing because if you're laying on your back, it will make it easier to do it without shrugging that shoulder. And that's tip number 3. So if you are struggling with a frozen shoulder, 1, grab a magazine and start circling shoulders. 2, get in front of the mirror and try moving that arm, the good arm, and look in the mirror and see what happens with the frozen arm. And 3, get some massage, and you can do it yourself if you're at home right now. Just try massaging around that shoulder a little bit and laying down and getting some active motion into that shoulder without the shoulder shrugging. That's very, very important and very, very common with our frozen shoulders. What have you tried for your frozen shoulder? Drop a comment below if you have any advice for anybody with frozen shoulder, if you have tried any techniques that worked really well for you, what you know about frozen shoulder and the connection to the brain, and any ideas for future videos. And before you leave, don't forget to hit that subscribe button and check out this video over here. Have a great day, everyone. Bye.